Welcome to Total Hip Replacement and Total Knee Replacement, What to Expect Prior to Your Surgery. Your surgeon's office or lab swabbed your nose prior to surgery to check for the presence of bacteria in your nasal passages. These bacteria are treated to help prevent a post-surgical infection at the joint replacement site. The nasal swab was most likely done at least 10 days, but oftentimes several weeks prior to your surgery. Results can be accessed via patient gateway, but your surgeon will contact you if treatment is needed. If the swab is negative for bacteria, no treatment is needed. If the swab is positive for bacteria, your surgeon will prescribe an antibiotic ointment called mupirocin or Bactroban. This should be applied for 5 days prior to surgery. Reach out to your surgeon's office for more details. When you arrive to your designated facility the morning of your surgery, you will check in at the reception desk with appropriate identification. We ask that you have only clear liquids after 10 p.m. the night before surgery and that you refrain from consuming anything by mouth 2 hours prior to your scheduled arrival time. These instructions are subject to change based on your health history and home medications. Following check-in, you will take a seat in the waiting room until a nurse takes you into the preoperative area. A family member or friend accompanying you will be brought back after you are prepped for surgery. We will verify your name, date of birth, planned procedure, and surgeon. We will ask your height and check your weight. You will be asked to use the restroom to empty your bladder before surgery, and if you meet criteria, we may require a urine sample to conduct a pregnancy test. If you believe you will need to provide a pregnancy test and need to use the restroom on arrival, please let the receptionist at the front desk know, and he or she will provide a specimen cup. You will be taken to a private room to change into a hospital gown, slipper socks, and a surgical hat. We ask that you leave jewelry, contact lenses, and other valuables at home. You will have access to your cell phone, glasses, hearing aids, and dentures until you go into the operating room, at which time we will store them safely in a locker for you. After you are changed, a nurse will attach a heart monitor to you by putting a series of stickers and leads on your chest. A blood pressure cuff will be placed on your arm and an oxygen monitor on your finger. A compression stocking will be put on your non-operative leg to promote circulation and blood clot prevention. In recovery, you will have these stockings on both of your legs. Your surgeon would like you to wear them during the day for 2 weeks. You may remove them at night. If needed, your operative leg will be prepped using surgical clippers to remove hair. An IV will be placed in your arm or hand so you can receive necessary medications and hydration. Please let your nurse know if you've had difficulty with IVs or blood draws in the past so that we can make this experience as comfortable as possible for you. Some of the things your pre-op nurse will need to know include when you last ate and drank, if you have any allergies, if you have any metal or implants in your body, if you've experienced any recent health changes, when you last took your home medications, if you've fallen recently, or if you have any open areas on your skin, like rashes or other skin conditions. Unless contraindicated, you will be given an anti-inflammatory pill with water before surgery. It's called celecoxib, but better known as Celebrex. You will not continue this medication after surgery. Both your surgeon and your anesthesiologist will see you prior to surgery, and your surgeon will mark your operative leg after confirming it with you. If you are having your knee replaced, the anesthesia team will perform a nerve block. The nerve block is performed by injecting numbing medication into your inner thigh to help with pain during and for 18 to 22 hours after surgery. You will be given pain medication through your IV for this procedure. Nerve blocks are not performed on hip replacements. Following the completion of the nerve block, you'll be taken to the operating room when it is ready. Do not hesitate to reach out to your surgeon with any preoperative questions, concerns, or changes in your condition. In lieu of a phone call, you may contact your surgeon electronically via Patient Gateway.